No, but you will have that. Is it better now? Can you hear us now? Shit. Okay. Okay, go. Okay. So sorry for the small mistake. I was saying that welcome to the demo Medical Robotics, and we are the team that will be carrying out today the demonstration. So yeah, let's get started with it. Should we go? Yeah, so I'm sure that all of you have heard about robotics before. They're pretty much everywhere at home, or you probably have seen them in ads or movies. But maybe you haven't heard about medical robotics. The concept is quite simple, right? They're robots that are used in medicine. But you may ask yourself, why are they so important and why do we need them? So unfortunately, even nowadays, there are so many surgical procedures that are very difficult to perform with the tools that we have, and these pose a risk to our health. And there are other procedures that we cannot even perform with the tools that we have. So by bringing robotics to men, we can try to solve or help with some of these problems. So just so you have an idea of what we can do with medical robotics, just imagine this tool is a tool that is used in neurosurgery. So it's really nice, it's very lightweight, and the profile is amazing. But we can do much better with medical robotics. And so, for instance, if you think of like a video game, right? When we play and we have some sort of feedback when our controller vibrates, right? So we can use that sort of stuff in medical tools, right? And this would be important in scenarios like when the surgeon is trying to operate and the force that is applying is very high. So we can make the tool vibrate and tell the surgeon to stop applying that much force. An example that excites me much more than this is when we cannot perceive the force that we apply and is dangerous for the patient, right? So in this case, we can use mechatronic devices to magnify and amplify the force that the surgeon applied and thus feel it. And it's kind of like having some sort of like superpowers, right? And enhance possibilities that as normal humans we cannot have. But yeah, I think that's enough speaking. We can go to the actual demonstration and show you how a real robot works. So we are going to be showcasing the Vinci, which is the robot that I have behind me. And yeah, just one quick second. Yeah, so as you can see, the Vinci has two arms, the red that you can see here on the left and the right, and the green and the red. And these two tools are as if the surgeon had his hand inside the patient, right? And every movement that our surgeon today sent, just remember he's a student, every movement that he's doing with these handles that he has are replicated in these two arms. And you may ask, how is he able to see what's going on inside, right? So the central arm, this one in here, is a camera that gives him visibility. And it's a stereoscopic camera that gives him a 3D vision of what's going on inside. Like some sort of like virtual reality game. And so if you think about it, it's like if the surgeon would be inside the patient with his hand and his eyes, but through three very tiny incisions. So it's like if you hadn't had surgery at all, right? Which might be a bit of a downer for some people, like you go through surgery and you don't have like an amazing scar, but so today we'll be doing a demonstration, as you can see in the screen. So this patient, of course, not a real patient, is suffering from the common disease of the lemon. You have to remove the seeds before the lemon tree grows in the patient. And as you can see, Seiyan is controlling everything that is going on in the robot. And of course, in a real surgical procedure, we don't need this. But as we do a lot of research in the center, and we implement our own algorithms, we have to control everything we do. And as you can see, it's a bunch of fancy things that here our friend Seiyan is working on. See if it's... Is it okay now? Is it better now? Yeah, so sorry for the microphone issues. But so we were saying that right now Sen is in the loop, right? But in the future, we would like to have this procedure to be performed autonomously, right? And we are doing some work in this line that would help us or will bring us to that point. And for instance, if you think of it, and you can see it on the screen, the lemon is static, right? And some of you already have thought about it, right? But if it was a heart, the heart is beating and is moving, right? So of course, Sense is able to realize of this motion and to compensate for it. But what about if we have an autonomous system? How do we tell the robot that the heart is moving? So everything in this line is being investigated in our center. And another problem that you might be noticing in this setup is the risk that using this robot might have, right? Sen knows what his target is, which is the lemon. But when we have an autonomous robot, how do we tell the robot which one is his target, right? So in that line, we can implement like no-go areas, like and just like create like a safety box in which the robot operates. And in that line, we also have some researcher. In this case, it's Seiyan, that is working in such a cool stuff. And last case, but probably the most obvious one, is that these tools are super stiff, right? And if you look at your hands, they are compliant and soft, right? So we have some researchers like Sen that are working in tools that can be added to this robotic system, and they can operate smoothly as a surgeon would do. I think that's pretty much from our side. We now have a Q&A session, so if you have any questions or doubts, just feel free to ask them. Thank you. So seems that we have first question from Mohammed Abdelaziz about how much the robot cost. So this robot is about £2 million, which is of course high price to pay for a device. But it's not been in the market for about like something like 20 years, and we are in that point of the technology in which other competitors are arriving, and hopefully we are at the point in which the price will start dropping and make it more accessible to more hospitals. So as we were saying, there are many different ways in which we can improve the robot. Basically, this robot, what we were doing was a lemon surgery, which is not any kind of a specific surgery, but it's been used mainly for laparoscopic surgery. Also have been tried for other type of surgeries, but in our center, we first developed robots that are specific for an application. That's one of the lines of investigation that we do here in the center. And as I was mentioning during the presentation, there are different ways in which we are working with this DVRK by trying to make procedure autonomous, try to teach the robot, this robot that we saw, which place to go and which place not to go to not damage healthy tissue. Try to modify the tool with new material and compliant material. And so those, we think, are the lines of in which research should be going. No, so I was saying, well, it started for laparoscopic surgery, but the robot has been used for many different procedures. For instance, cardiovascular surgery as well. But in this type of procedure, and I mean like cardiac surgery, for instance, you have other problems. So you can imagine, like, if the well, you have problems like minimal invasive surgery is more risky, right? And for instance, if the aorta start bleeding, sometimes what the surgeon does is just to place the finger right until they solve the problem. With this type of robot, those procedures are not that affordable. No, it shouldn't cause any safety problems. The robot is using traditional laparoscopic tools, so if anything would happen with robot, that it shouldn't, and it wouldn't, but if it happens, this tool can easily be removed, and the surgeon could continue the procedure with traditional tools, or just open and do open surgery. Just, I want to mention that I'm not a surgeon, just an engineer. So if there are any inaccuracies in my answer, I apologize for that. Okay. Yeah, thank you. My name is, well, probably some issues with mic. So welcome to our demo of medical robotics. My name is Daniel. I'm a researcher at the Hamlyn Centre. And before we started, I wanted to introduce you to the team. So Sen is also a researcher. He will be showing you how a surgeon operates a medical robot. And Seiyan and Christina will be helping us, making sure that everything runs smoothly and that you can watch this video without any problem. So yeah, we can start. So I'm sure that all of you have heard or seen robotics at robots at some point. They're everywhere in ads, movies, or I don't know. Even if you're lucky, you may have some robots at home, right? But maybe you haven't heard of medical robotics. And so medical robots, the concept is quite straightforward, right? It's robots that we use in medicine. But you may ask why they are important or why do we need them? So unfortunately, some of the procedures that we do nowadays, they are very difficult to perform with the tools that surgeons have. And this is a high risk to our health and make the procedure more difficult. And in other cases, we don't have the tools and to perform the procedure. So it's here when medical robotics and robotic devices can help and can assist the surgeon to make surgery safer and more accurate, and in turn provide better outcomes to the patient. And so to give you an idea of what robotics can do, this is just a tool that is used in neurosurgery. And this tool is used to remove tissue from our way, or to pick up something. But you know that the brain is very delicate, right? So we want to do this in a very accurate and soft manner. But sometimes the forces that we have to apply in order to not damage the tissue have to be very, very small, right? And it's here where robotics can actually help. And for instance, we could have a system that magnifies the perception of force, right? So with your hand, your bare hand, you can feel when you try to take something, right? But when it's very, very small, you might not feel it. So we can have a mechatronic system that magnifies and enhances the capabilities of our hands, and then allow us to feel something that before we couldn't. So it's pretty cool. But yeah, let's go to the robot that we will be showcasing today. That is called the Vinci, and this robot is the one that I have behind me. And as you can see, it has two arms that are moving at the moment. The red arm and on the right, and the green arm on the left. So these two arms are as if the surgeon would have his hands inside the patient, right? And to move them, our surgeon for a day, Sen, has a console with a bunch of handles, to be precise, that he moves to control these two arms. And you may be asking, how is he able to see what's going on inside, right? And that's why we use the third arm in the middle. It's a stereoscopic camera that provides Sen a 3D vision of what's going on inside. And so as you can see, he can observe everything that's going on inside our patient. And so if you think about it, it's like if the surgeon would be inside the patient with his eyes, his hands, and that with only like 3 tiny scars, as you can see right now. And So for the demonstration, as you can see already in the left of your image, we will be trying to operate the famous disease of the lemon, very common in the London area. So our surgeon, Sen, well, just remind he's a student. So probably some of the movements are not very orthodox, but he's trying to get access to the lemon tumor, and after that he will resect the tumor. And so, and as you can see, the surgeon is still performing all the operations, so he's in control of doing everything. But if we think about the future, right? So how the procedure will be, like we just need to imagine like in movies, right? Like just like laying on a table and then some sort of automatic devices carry out the procedure, right? So for that future, we need to teach them the robot some stuff. And for instance, the lemon in this case is a static object, right? But when we operate in a human, tissue due to breathing will move, and we have to teach the robot how to compensate for that movement in order to have an autonomous procedure. And so in those lines, we are doing some research in the center with very cool results that help the robot to know when the tissue is moving and to move and shift with the breathing. And if we keep thinking about these autonomous procedures, we can think about, like for instance, like now Sen knows that he has to target the lemon, right? But wait. Wait. Sorry for that mistake. But yeah, like Sen knows that he has what his target is. He's in control of everything. But when we leave this robot to operate on its own, we have to somehow teach the robot where to go and where not to go. It's kind of like in a video game, if you think about it. Like you're like playing in some parts of the map of your game, right? And you cannot go to other areas of the map, right? So in that area, our friend Sejan is doing some amazing research on how to teach a robot where to go, where not to go, and of course account for all the movement in tissue, because these no-go areas will change as the patient breathes. And you can see it's very cool, like all the controls that Sejan is working on at the moment. Of course, this is something that you will not have in an operating procedure where everything is already implemented. But in our case, since we're investigating with it, we keep control of everything. And we have here all the control boxes that are used to send the signal to the robot. And lately, another piece of research that we do in the center is, as you can see, all these tools are very stiff, right? But if you look at yourself, right, you look at your hands and you think of a surgeon's hands, they are soft and they are compliant, and they're gentle with the tissue, or at least I hope that they are gentle when they perform surgery on us. But these ones are stiff and they are not compliant, and so our researchers, especially Sam, is now in the image, he's doing amazing work and amazing research in creating soft devices driven by pneumatics that can do as the surgeon hands. And I think this is the end of our demo. So we can now answer some questions if you have them. And thank you for listening. Sorry. In what areas of surgery are these robots most commonly used? So these robots have been used in pretty much all surgical procedure, but it's most commonly used in laparoscopic surgery, as these tools are very similar to laparoscopic tools. Yeah, just reading one of the comments. Yeah, not sure if the lemon will survive. We will try to give an update a bit later. We have some casualties today, but yeah, we normally save the lemon. But yeah, coming back to the question, sorry, is normally laparoscopic surgery, but this robot have been used in cardiac surgery and also in ENT surgery, for instance, in cochlear implant surgery, which is the surgical procedure of implanting these hearing devices in this area. We have the facial nerve that we try to avoid. And in the goggles that Sen is using to control the arms, we can introduce very cool augmented reality features that guide the surgeon to avoid, in this case, the facial nerve. So yeah, they can be used in many different surgical procedures. Yeah, about the tools. Right now, we are using research equipment, so we use this equipment many times. But when it comes to surgery, these tools are used for many trials. Specifically, each tool can be used for up to 10 trials. Just an update. Apparently, the lemon has survived. So, yeah, I think we can all be a little happier today. Yep, there are different platforms that are being developed in this line. It's quite exciting because these days we can see more of these devices getting out there. There is another company in Cambridge doing similar robotics, and there are a bunch of other companies outside the UK developing other robots. But this one, the Da Vinci, has this research kit that I mentioned before that allow us to implement the algorithms, the tools, and that I was discussing before. Well, I think that's a very good question. I think you need to be very motivated and passionate about robotics as we are. At the end, it's true that we are trying to solve something that is very highly complicated and very important. When it comes to health, everything takes another color. But at the end, we're working with robots, which is something very cool, right? So if you're excited about it, you will find your opportunity in robotics. And about what to study, we are from very different backgrounds. Like in my case, I'm a mechanical engineer, but we have computer scientists, we have bioengineers, and of course there are a lot of doctors working with us, because of course this is a mechanical system, right? But the views of the surgeon are very important, and they sometimes can come up with very good ideas. Well, I think it depends on the person, right? On the interest and what do you want to do. In my case, the differentiating factor with other things, with other type of robotics, is the interaction with clinicians and the being able to develop something alongside clinicians. I think those conversations are usually very, very interesting and fruitful, and for me is that key factor that make it different from other robotics robotic fields. Yeah, of course. Like, it's totally possible that one day robots will be autonomous. And as I was saying, this is what we are working for, right? We we would like this robot to be autonomous in the future, but the reality is that we are very far from that point. We are getting some great results, very exciting, but when it comes to surgery, you cannot have something that works half of the time, right? And if you think, for instance, of these robots that sometimes we have at home, this Roomba that cleans the floor, sometimes they make it wrong, right? And they go to the wrong corner, or Like they don't clean as good as they should, right? So of course, most of the time they do it properly, but not 100%. And that's not something that we can accept in surgery. So we need very robust system. And to get to that point, there is still a long way to go. So if someone with interest in this is watching, would encourage them to pursue a career in this field, because there is a lot of work and a lot of things to be done in the next years. Uh, yes and no. Uh, like everything, like everything in life, I think communication is a skill to be learned, right? And it's true that communicating with your peers or your equals, right, is easier than communicating with someone with a different background. But once that you develop the skill, I think it's uh, something that um, goes smoothly, and the results start coming. What any register? Um, well, I guess this question, it's a very good question, uh, but I think it would depend also to who you ask this question. Um, if you talk to me that I work with smart materials, and then I will tell you that probably the future is to work with different material, and because we've seen so many technologies with very like cool memory effect materials that can do great things in surgery. Uh, so as the question, I've been answering the question, I would say that new materials would be one of the areas that could benefit surgical robotics in the next 5 years. So yeah, I think we can stop here. We will be having a next session. Well, we will repeat the session starting at 5 London time. So yeah, see you then.
The wrong camera.
The main camera is.
Okay. So yeah, hello and welcome to our demo of medical robotics. My name is Daniel. I'm a researcher at the Hamlyn Centre, and I will be guiding you through this demonstration that we have prepared. But before we start, I wanted to introduce you to my colleagues that will be helping me today. Sen will be showing you how a surgeon operates a medical robot, and Seiyan and Christina will be making sure that the robots operate smoothly. So yeah, we can start now. If there are any issues with microphone, just post a message in the chat and we'll try to fix it on the way. So yeah, I'm sure that all of you have heard about robotics before. They are almost everywhere these days, right? They are in ads, movies, sometimes even at home, right? If you are lucky enough to have one of these like tiny devices. But maybe you haven't heard about medical robotics, right? The concept is simple to understand. They're just robots that are used with medical purposes. But you may ask yourself, why are they important, or why do we need them? And so the fact is that even nowadays in surgical procedure, there are some um, procedures that are very difficult to perform with the tools that surgeons have. And this poses risk to our health and make surgical procedure more difficult to perform. And there are other like surgical procedure that should be very accurate, and due to this accuracy or difficulty of access, cannot be performed with the tools that we currently have. And this is where we think that, among other areas, that medical robotics could help in the future. And as you can see right now, this is a tool that is used in neurosurgery. It's quite a cool one. It's very lightweight. I'm a mechanical engineer, so I think I can appreciate the details of it, but it's lightweight, the profile is really amazing, and something very difficult to produce. But it's not enough for a lot of surgical procedures. And this is a point where medical robotics could help. And if you think, for instance, where you're playing a game and you have the control and you maybe jump to a place or like you fall through a cliff, something like that, then your joystick might vibrate, for instance, right? And it's giving you feedback that something is happening in the game. And so there are tools that have been developed and that follow like a similar concept, right? And so you can be operating, and if you produce a force higher than what our body would tolerate, then the tool can vibrate or send an alert to the surgeon. And so this is a great advantage of robotics tools in comparison with current tools. And another thing that they can do is to enhance the possibilities of the surgeon, to make them perceive more than we as humans can do. And if you think like very, very, very tiny and delicate things in our body, things that in order to grasp them, we wouldn't be able to perceive the force that is applied. So we can create a tool like this, embed an amazing set of electronics in here that would make it to look much cooler than it does right now. And this tool would allow us to perceive forces that otherwise we are not able to perceive. So as you can see, there are many things that robotics can do in surgery. And this is just a tiny example. There are hundreds of examples that we could explain. But probably it's better to start explaining a real example. And here in my bag, I have a surgical robot that has been used in actual surgical procedures for as many as 20 years. And we're going to be doing a demonstration with it right now. So yeah, we can start with it. And as we mentioned before, we will have Sen doing the job of a surgeon. There we have the control box that allow us to do all of our research and implement our things. This is our robot. And here you have Seiyan taking care that everything runs smoothly. And you can see all his fancy stuff he's working on. You have also Neo on the back. He's our colleague that help us with selecting the tools for the robot. But yeah, coming back to the actual robot, as you can see, it has 3 arms. But let's focus for the moment on the green on the left and red on the right. So these 2 arms are as if the surgeon would be inside the patient, right? So it's quite cool to think about that. And if you ask yourself, how do they move? Here we have Sen that is moving these 2 pair of handles. And every movement that Sen does is translated in real time to these pairs of arms. And you may ask now, but how does he know what he's doing inside the patient? And for that, we have the arm in the middle. And so that arm is a stereoscopic camera that is looking at what the arms do. And it's sending that video in real time to Sen that has a 3D vision through those goggles that you can see there, and through those eyepieces. And he has a 3D vision of everything that is going on inside. So in summary, like this robot, it says, if you go inside the patient with your eyes, your hands, everything, but only through 3 very tiny incisions, as you can see here. And so, as you can already see in your left screen, our task today is to save this patient which is suffering from the lemon disease. This consists in peeling the lemon, and then we have to get access to a small tumor or seed and remove it from the patient. And we have to do that quick. Otherwise, you will start noticing how the tree will start growing in our patient, and of course, we don't want the tree in the lab. So you can see the fine movement that Sen is able to perform with the robotic tools. And just think about it. It's like everything done in real time from a console, kind of like if you were playing a video game, right? But if we like really focus on what's going on, we're talking a lot about Zen. So I think you'll feel great after the presentation. But he's in control of everything, right? He's looking at the lemon. He knows where the arm should go, and he's making all decisions, right? But if we like put our mind a bit forward, right? Like how the future of surgical robotics would look like, and we would think of an autonomous procedure, right, in which the surgeon is still in the picture, right, supervising, but the robot is able to do everything on its own. But before we do that, we have to teach the robot how to do these things. And the first thing would be how to teach the body movement. And as you can appreciate, the lemon doesn't move. Well, it moves if we push it away, but it doesn't have any inherent movement. And if you think about yourself and you put your hand over your chest, you can see that your heart is beating, you are breathing, and your lungs are expanding. And those movements is something easy for us to understand, but when it comes to teach the robot, it becomes a bit more complex. So in that line, we have some research that is trying to understand how tissue and how organs move and try to teach that to the robot. Other things that would be a problem in case, or something to solve in case of an autonomous procedure, would be where to go, how to decide what part of the body to operate, which parts to stay away. So, and all of these dynamically as everything moves and changes, things change. So we have also research that is able to like define a space, like a safe space in which the tool can operate, and just like the way that we implement it, it wouldn't allow the robot to go outside those safe areas. And lastly, I wanted to talk also about one last example, which would be the case of the tools. And as you can see, these tools, you can see manipulating the lemon. They have some wrist and they can do some movement, but they're quite stiff, right? And they are not as the surgeon hands, right? That are soft, they're gentle with the tissue, and they are compliant. And so we're also working in new tools that they will be soft and they will be more like we're used to. They will be more like our hands. So these are some examples of what we are doing. We, of course, are working on all the different points of this robot and other robots, but I think you have now a good impression of it. So thank you for listening. We now have a Q&A session, so just feel free to ask any questions that you may have. Thank you. Thank you for the update on the result. Yeah, I'm enjoying a lot the presentation, but also suffering from my fellow citizens from Spain. Please keep me posted on any changes in the score. So we have a question from Mohammed Abdelaziz asking if it's possible to make this robot cheaper. Yeah, I think it's possible to make them, but so far, this is or up to at least last year, this was the only well, I'm on the way. This was the only big robot out there. So without competition, it makes it more difficult to have something cheaper or to make the prices of this robot to drop. So it's like another key factor to start to keep doing the work we do to get more robot out there and to make it more make it cheaper. Okay, so I think if there are no more questions, we can stop it here, and we will repeat the same session in 10 minutes, starting at 5:30. Okay. So welcome for this last round of today's demo on medical robotics. My name is Daniel, and I'm a researcher here at Hamlyn Centre. And before we start, I wanted to introduce you to the team that will be doing the demo. So I will be talking through it, and Christina and Seyan will make sure that everything runs smoothly, the robots and everything. And Sam will be showing you how surgeons operate the robot that we are going to present today. So now that presentation are made, we can go ahead with the actual presentation. So I'm sure that most of you, all of you, have seen or heard about robots before, because they are everywhere in ads, movies, even at home. There are tiny devices like the ones that clean the floor. So they're pretty accessible these days. But maybe you didn't know that some robots were used in surgery. But the fact is that they are. And the question that you may have is, why are they important? Why do we need them in surgery? And the reason is that, unfortunately, with the tools that surgeon has these days, they cannot do some procedures because they are very risky or they are not possible to do. Some other are very difficult to carry out with the tools that they have. And this is a high risk to our health. So it's here when we can use the help of medical robotics, the help of robotics to improve surgical procedures. And before showing you how this big robot that I had behind me works, and I wanted to give you a small introduction of what can be done with robotics. There are many things that can be done, but these two are among my favorite examples. So this tool is a tool that is used in neurosurgery. So it's very lightweight, very precise, very nice to the touch, but it limits the surgeon, or, well, it doesn't limit the surgeon, but it doesn't allow the surgeon to perform beyond his abilities. While if we put some amazing robotic system or mechatronic system in it, we will be able to do things that we normally cannot do, that we are limited to do as humans. So if you think, for instance, when you're playing a video game, right? Or even when you are using your smartphone and you are touching the screen, if you have deactivated, you will not follow the analogy, so hopefully you haven't done it. But when you touch the screen, you feel a small vibration that tells you that you are going through a new folder or that you are doing a new task, right? So following the similar concept, we can embed the necessary hardware in these forceps. And so when we perform the task, if we do something that is dangerous for the patient, the tool can vibrate, for instance, or can send a small alert to the surgeon so he knows that he has to stop. And these are small things, but that are very important and improve by a lot current surgical procedures. And another thing that could be done here is when you think about neurosurgery, for instance, or other type of very small surgeries, the forces that we apply are very tiny. and sometimes you are not even able to perceive them. So we can have the hardware necessary to magnify those forces and be able to perceive them. And that's pretty cool because somehow it's like enhancing your own human abilities, right? And let's stop talking because I think I'm talking too much. And we can move to the actual demo with the robot that I have in my bag. And you can have a taste of how it works. So Sen, which is our surgeon for today, is already moving. And you can see how the arm on the left and the arm on the right are the ones that go inside the patient. They are doing a small movement at the moment. And this is pretty impressive because it's like if the surgeon would have his hands inside the patient, right? And so everything that the surgeon, or in our case, Sen, does in here is replicated in these two arms in real time. And you maybe wonder, like, how is Sam able to see what's going on inside, right? And for that, we have here this camera. It's a stereoscopic camera that is providing Sam a 3D vision of what's going on in the robot. And all of it in real time. So as you can see, Sam is leaning forward, and in his eyes there are two eyepieces giving him a 3D vision of everything that is going on inside. And so for today's demonstration, we are going to be operating this person that we have here. Of course, it's not a person, it's just a fake body, just in case. And this patient has the lemon disease, very common in the London area, especially North London. Probably you haven't heard about it, but it's getting quite common. And this procedure consists in removing some layers of tissue, and after that, resecting a small tumor that has the shape, has the shape of a seed. So before we go, I wanted to show you, because I think this is something pretty impressive, and it's obviously something that we don't have in surgery, but when it comes to research, we are working with the DBRK, right? So it's an extension of this robot, and we can like introduce in there a bunch of like fancy algorithms and like a lot of like mathematical models as well, and artificial intelligence algorithms. And so Sejan is our expert in the matter. So he's running like a small example of how an engineer would perform here in the center day to day, working with this robot. And in the meantime, Sen is doing some adjustment in the robot. And so while they prepare the actual presentation, we can keep talking about some interesting stuff that will should be done in the future. And as you can notice, Sen is the one in charge of doing everything in this surgical procedure, right? So he's making the decision of where the arms should move, what should they do, and if the tissue is moving, etc., right? But when it comes to a real surgical procedure, things are not. Sorry. But if we want to think about the future and an autonomous procedure in the future, we have to teach the robot to think the same way that the surgeon is thinking or is making decisions, right? So you may see it, right? And the lemon is something that is static, right? It doesn't have any movement. But if you think of your own body, like just placing the hand on your chest, you can feel the movement, or you can feel the heartbeats of your heart, right? And this is something that we have to teach the robot to understand, to compensate for all this motion, right? So we are doing research in this line, and other important things to take into account is how do we decide the target for our robot. And for Zen, it's very simple to say, oh, I'm going for the lemon. This is what I want to do, and this is the seat, etc. And next to it, I have the ribs, or I have the lungs, and I should be very careful not to touch them. So this is an easy judgment for us as humans, but how do we teach them to the robot, right? It's not such a simple thing. And if we think of how everything is moving, it makes it even more complex. So Ziyan, which is one of the friends that is helping us today, is working in solving this problem. And if you want to have like a small idea of how this would work, you can think of like in a video game where you can only go to certain sections of the map, right? So it's kind of like having a safe area in which the robot can operate and some no-go areas around it. And another example, and something like really, really cool that Zen is working on, is on new tools. And you can see it clearly, is these tools are amazing. But if you think about them, they're quite stiff, right? So we go from the hands of the surgeon, which are soft, they are gentle, they are nice, right? They are compliant. But then we go to these tools, and they are hard and they are stiff. So Zen is working in soft robotics, pneumatically actuated, that could help to do the surgery more gentle and to cause less trauma to the patient. So these are some examples, but you may have other questions or maybe other areas that could be of your interest applied to medical robotics or to other robotics system. And so now we'll have a few minutes for questions, and so feel free to ask anything you want. And thank you. Wow, quite quick. So we have a first question from Mohammed Abdelaziz. He's asking if these robots are used in UK hospitals. So the answer to that is yes. There are. I don't have the numbers of how many of these robots are used in the UK, but yeah, they are definitely used in the UK, and they have been used for some years now. From a researcher point of view, we develop robots for pretty much every procedure. But I wouldn't be 100% sure to which procedures robots are approved. This robot is definitely used in laparoscopic surgery, but I wouldn't be able to answer to which other procedures, in which other procedure this robot could be used. So Christina's asking how robotic-assisted surgery is different than laparoscopy. Well, they have some similarities and some differences, and I think some of them we have outlined them today. So the tools are pretty much the same as the one in this robot, with differences, of course, but very similar. But a robotic-assisted system has some of the advantages that we've been talking about. And one that we haven't mentioned, but for me is one of the coolest, is like when Sen is moving. Well, if you think a surgeon that is moving this laparoscopic tool, we all have some inherent tremor in our hand, right? So the tool will be trembling a bit, even if you're a super amazing experienced surgeon. But when it comes to robotic assisted surgery, we can use control in different control approaches to remove this tremor. And so even that the hands of the surgeon may tremble a bit, that will not be seen in the tool, that will smoothly run and without seeing this tremor. So that would be one of the differences between both of them. I think this is a good question. So Pillada is asking, how long should a surgeon practice on this robot to be ready to operate on a real patient? This depends on it usually depends on the degree of expertise of the surgeon. So, and I think it's applicable to other disciplines, but when we go to very experienced surgeons that they know how to operate without robots, and they are very proficient at it, they find it the learning curve might be a bit steeper. For younger surgeons that have been born with video games and that they are not so used to do this procedure manually, the learning curve is less steep. Yeah, of course. So Florent Josephine is asking if the surgeon could be located in the moon. And so actually these robots were developed for that, to be able to operate from Earth, people in the International Space Station or in another planet. But there is a small issue with all of that, which is that both systems have to communicate in real time. And when the robot goes to, so when there is such a huge distance between both systems, there is a delay, and that delay is critical for surgical procedures. So the question is that at least nowadays, it wouldn't, so the answer would be no, at least not these days. So Alia is asking if they ask for patient consent prior to undergoing robotic surgery. Unfortunately, I don't have the answer for these questions. I understand that for any surgical procedure, the patient is asked for consent. I don't know if it is a different type of consent for a robotic system, or if you would be given the chance of a different type of surgery. I'm sorry for that. Yep. Thank you, Mohammed. That makes me very happy. So Ali is also asking if this will be fully autonomous someday, and our hope is that it will be, but we've been discussing that throughout the day. I think we are a long way to autonomous procedure, because we can do many things autonomously, but when it comes to surgery, it has to be 100% robust. There cannot be any flow. So to get to that point, I think we are a bit far, but we can do some tasks autonomously with the help of Visium and using artificial intelligence. That is very trending these days. So hopefully one day, but probably not in the next 5 years at least. So I think it's last 2 minutes. So if you have any last minute question, I think we'll be very happy to answer them. Yep. Sen and Sejan are informing that the lemon is fine. We have a bit of trouble with round 2 with the lemon, I mean, but he finally survived. So I think we can confirm that the 4 lemons have survived today. Thanks a lot for listening, and yep, thank you.